So, today on the Middle Aged Zebra, I want to talk about shoulder encapsulated joints or frozen shoulders. This actually is a common occurrence in hypermobile EDS, especially in older patients with hypermobile EDS. Because what basically happens is with overuse and continued subluxations and dislocations, our ligaments and tendons become very loose in our shoulders, and we have quite a bit of shoulder problems. And one of the problems that tends to end up happening is with those subluxations and dislocations, we start to have thickening of the capsule that happens, and this is known as a frozen shoulder joint. When that happens, it kind of sneaks up on us. All of a sudden, we'll start to lose functioning of our shoulder, and we'll also have pain that runs down the arm. You noticed decreased range of motion, and it doesn't happen fast, it happens over time. And when you have pain in a joint, we tend to want to rest the joint. But the more we rest the joint, the more functioning that we lose. And before we know it, we barely have any range of motion at all. So, really, with an encapsulated shoulder joint, we want to do as much range of motion as possible, take NSAIDs, and apply heat. Sometimes that's still not enough, and then you have to seek out treatment for the encapsulated shoulder joint. So, this is when you go to your shoulder specialist. There are a couple of options of treatments for the encapsulated joint that's not surgical. One of them being a corticosteroid injection. And that's fine as long as you're not having to have these injections really frequently, because there are side effects to the steroid injections, especially if you have diabetes or hypertension. It can increase your risk for infections, blood clots, sepsis, more joint destruction. Some people will complain of blurred vision. There's another option, and that is platelet rich plasma injections. So it's your own plasma that they give you, and they say that these are more effective in terms of improved pain, disability, and range of motion for the adhesive capsulitis that we get with the frozen shoulder. The problem that I have seen with the platelet rich plasma injections, it's not like you can run out to your primary care doctor and get one of those injections. So it's not as easy to find people who give those injections, whereas steroid injections are much easier to find someone to give that to you. So you would actually have to look around to find a specialist that gives those. But if you're having to get injections frequently for this problem, because once you've had an encapsulated shoulder joint, you're pretty much going to get it again, because you've got the problem that things are loose in your shoulder due to ligament and tendon wear and tear, and you're going to have the inflammation. It's going to tighten back up, and you're going to have the limited range of motion that's going to come back, and you're going to need treatment. So, talk to your doctor about it if you're experiencing these problems, and just know that if you have pain that's in your shoulder and it's back on this part and it tends to run down the front of your arm, it almost feels like your arm is broken in this part because you don't want to move your arm. And when you lay down at night, that's when you have a lot of pain, because if you lay on the back of your shoulder, it hurts, and whenever you put pressure on your shoulder, it hurts. And then you'll start noticing that the range of motion that you have starts decreasing, because whenever you get to certain points, the pain is very, very intense. I have had doctors tell me that that's just the opposite of what people with hypermobile EDS experience. However, I have a lot of people in my family that have hypermobile EDS, and they have all experienced encapsulated shoulders. So I did do some research on it and found that it's actually a very common occurrence in hypermobile EDS. So, treatments until you go to the doctor: NSAIDs, heating pad, and range of motion exercises, even though it hurts. Once you go to the doctor, talk to them about whether or not corticosteroid injections or the platelet rich plasma is a better option for you. Thank you for joining my show today. And if you are experiencing an encapsulated shoulder, I would like for you to comment below and let me know what your experience has been. Thank you. Have a good day.